Welcome to the American Hospital Association's webinar for trustees on supporting high-performing boards, dedicated governance leadership. I am pleased to introduce our presenter. Luanne Stout is the president and CEO of Luanne R. Stout & Associates Incorporated, a governance consulting firm. She has over 40 years of governance experience, including 20 years as vice president, chief governance officer, and corporate secretary for one of the largest nonprofit healthcare systems in the country. Ms. Stout has worked with nonprofits and public systems, hospitals, physician organizations, joint ventures, and others to develop their governance structure and infrastructure, including after mergers and progressive governance restructuring. It is now my pleasure to turn the program over to Ms. Luanne Stout.
Thank you for having me today. Approximately 66% of U.S. hospitals are now part of health systems, according to 2018 survey data from the American Hospital Association. As systems grow in scope and complexity, their governance often follows suit. System growth typically results in more boards, at least in early stages, and reallocation of governance roles and responsibilities among boards at different levels and functional areas of the system. As system maturity creates the need for governance to evolve, more sophisticated, nuanced governance creates the need for more and better board support. Whether you're a system, a freestanding hospital, a public hospital, or urban, suburban, or rural, or all of the above, today's topics will apply to you. The current state of healthcare governance staffing might be described as all over the map, from executive assistants to legal counsel to other executives. A growing number of health systems, however, are making the commitment to dedicated governance support staff, such as governance managers or directors, or chief governance officers at the vice president or senior vice president level. Today we will discuss a pathway to a greater competence that can help governance staff better understand the components of an effective governance support program and the hard and soft skills they will need to become effective governance leaders. While no recognized educational degree or training program now exists for governance support personnel, those interested in gaining greater expertise can educate and prepare themselves to take on increasing responsibility. So what kind of tools should a governance leader have in a well-designed governance plan? On this slide, we have a list of the most key fundamentals. You must first have an orientation program, ongoing education plan, board job descriptions, the clarity of the comparative board authority of the system and entity boards, or often called an authority matrix, board processes and infrastructure, such as standardized agendas and reporting, board competencies and succession planning, board committee support, board chair training and support, self-assessment, a communications plan for your boards, and a board database and information support. There are standards and best practices for each of these tools. Candidly, most organizations have a lot of these components already, and most of them could be doing better. As an example, how many of you have a formal orientation manual for your board or boards? Great. So how many of those manuals are 50 pages or less? Orientation should not be a fire hose in the face. It should be day one education, followed by ongoing education, with a greater emphasis on the first 18 months. Another example is education. How many of you have education beyond your board presentation? How many either provide an annual retreat or conference or send your board to one? How many do more than that? I would suggest to you that with today's multi-generational boards, you should have a variety of educational modalities designed to appeal to every generation and personality. For example, electronic newsletters, digital and paper availability of trustee-directed publications, such as Trustee Insights, a trustee web portal that provides selected articles and focused information on how your organization approaches things like population health, healthcare reform, private and public exchanges. Board meeting presentations should go beyond today's agenda items. There should be strategic educational sessions as well. This chart, which covers 3 slides, illustrates the different pathways for a governance leader at all levels for different types of organizations, as well as a summary of the determining factors and skills and attributes at each level. Let's briefly review the levels and the differences between them. So at the lowest level, which probably everyone is familiar, you have an executive assistant, usually to the CEO, or perhaps a paralegal, who does see this in freestanding hospitals or small organizations with one or two boards. This individual would typically handle assembly and distribution of meeting materials and calendars, facilitating communication among the CEO and board members, maintaining board documentation, and providing logistical support. They need basic skill levels, which we'll talk about a little bit later. There are some standard skill levels that are necessary for all levels that become more sophisticated with each advancing level. The next level up would be a board liaison or manager dedicated only to supporting governance. That means it's their full-time job. They don't do other duties along with governance. Most small to medium hospitals with 2 to 4 boards might have an individual at this level. That person would begin to identify sound governance practices and developing templates to implement them. They're also coordinating the meetings and materials for board meetings and retrieves from multiple sources. They're supporting the board leaders. And they're working on board development and evaluation and taking meeting minutes. This individual needs to have a few more skills, a little more flexibility and creativity. Also, you're starting to probably begin to look for a bachelor's degree. The next level will be a director. You'll see this in small to medium to even large systems with multiple boards and multiple organizational levels. This individual begins to lead the governance function and staff organization-wide. They'll explore the broader healthcare sector and become more familiar with healthcare industry as a whole and governance connections to it. They'll design and execute all governance plans and components and ensure coordinated, standardized board activities occur system-wide. This individual you're probably starting to look at would begin to hopefully have a master's degree, but certainly a bachelor's degree. And finally, the highest level would be your chief governance officer, who would be at the officer level, generally a vice president or senior vice president. Most large systems with multiple boards and organizational levels would begin to think about having someone at this level. This individual would plan and oversee a comprehensive multi-year governance program and organization-wide. And they would also look at compliance with relevant laws and regulations, managing an authority matrix, working with the C-suite closely on governance matters, oftentimes even serving as part of the C-suite in their regular meetings in order to ensure that governance is in lockstep with the organization's strategies. This individual we're starting to look at would have a master's degree in healthcare administration, possibly a legal background as well, certainly a healthcare leadership background, the same sorts of training and experience and education that you would be looking for in other officer-level leaders. They will be coordinating with both executives and board members. There are pros and cons for each of these levels, obviously beginning with cost. The more sophisticated, experienced, and educated individual that you have, the more this individual will cost. The more sophisticated your governance program, the more support staff the individual will require. However, the pros are very significant. You can get a progressively more sophisticated governance program, the higher level, the governance leader. So these are the things, I won't read all of those to you, but you can look at those in more detail. So this next slide is a more detailed look at the key factors that organizations should consider in determining their level of needed governance support. These include number of boards, how many do you have? Complexity and scope of the organization. How many different boards, not only different boards, but also how many board committees? What other ancillary services do you have? How broad is your geographic scope? These are the kinds of things that you would think about as well. Breadth of governance functions. For your governance leader, what all does your governance function include? Are they handling all of the corporate secretary functions and minutes taking and maintenance? Are they also handling the authority matrix? These are things that demand a higher level of maturity and sophistication of the leader. Your status of organizational health. If your organization is in great health as a whole, then it's easier to make changes and advance your governance program during that time while you're doing well. What's left for you to do that you haven't done yet? However, if your organization is struggling, you may have a more imperative to build a solid governance program in order to serve as a foundation for building a healthier organization. And then obviously, the ability, knowledge, and skills of the governance leader and what they're able to do for you. Let's begin to talk about that now. The next slide illustrates in more detail the specific professional knowledge and skills needed by a governance leader. I would argue that any governance leader at any level needs these skills. Obviously, you'll get more complex and more sophisticated with each growing level. Strong interpersonal skills and the ability to build solid rapport with others, absolutely critical. Effective communication skills as well as to include listening and responding. Visionary, big picture thinking. Strong project management skills. The ability to write clearly and succinctly. The ability to synthesize information real time. Governance, as you know, doesn't stand still because healthcare doesn't stand still. The ability to work within organizational politics and with all departments. Governance touches not only your boards, it touches strategy, quality, finance, all of your departments within the organization, and this individual must be able to coordinate in and out all of those different realms. Analytical skills, critical thinking skills, the willingness and ability to learn and stay informed about the healthcare industry and environment, and a strong customer service orientation. The individual will also need to have personal attributes. This slide indicates some of the more important personal attributes. A strong, independently motivated work ethic. As we mentioned previously, there is no formal governance training program, so this individual will have to take it upon themselves to educate themselves about what others are doing and have achieved in the governance realm, and be able to adapt those tools to be able to serve the organization that you have. Flexibility. Healthcare is constantly changing, and therefore so should governance in order to adapt to it. Good judgment and discernment. Highly discriminating and able to keep matters confidential. The most confidential matters in your organization are being discussed at the board level. Your governance leader needs to be able to handle that. Capacity to embrace change. Critically important. Not everybody does, but your governance leader should. Be detail-oriented and have a professional appearance and style. So let's talk about, in summary, a healthcare system and their boards deserve a dedicated governance leader, someone who devotes their full time and attention to managing the governance plan and program and the boards. There are essential functions that should be part of any program in governance, and we've covered some of those earlier. There are different levels of governance leaders and pathways for them to advance. One person who starts out at a lower level may not stay there. They should be working to advance their skills in order to be considered for a higher level position, both either within the organization or outside the organization. We have reviewed today the key factors that determine which level of governance staffing and organizational needs, as well as the factors that help the organization know when it is in need of advancement. Regardless of the current level of governance leader, the position should be a full-time position, and the individual should possess the skills and attributes that will provide the basis for the development, maintenance, and advancement of an exceptional multi-year governance program. We have provided for you some discussion questions to help you ascertain where you are on the spectrum, what level of governance professional that you need, and where you are in your level of sophistication. Discussion question 1, does your governance program include all the key components discussed? Number 2, do you have a leader focused primarily on governance? Looking at the factors, what level should you have? Does that individual have the skills and attributes necessary to advance your governance program? And number 4, have you created a pathway for both advancing your governance program and your governance leader? If not, how might you approach this? I hope that you found this session helpful today. If you would like to have more information about AHA's trustee services, please contact trustees@aha.org. If you have any questions for me about today's presentation or related topics, I may be contacted at Luanne Stout at stoutassociates.com. Thank you very much.